The following segment is presented by Bremo Pharmacy.
Did you have chickenpox as a child? If you did, chances are you absolutely remember that time. If you had it as a child, though, you are at risk for developing shingles later in life. With the help of the Zostavax vaccine, shingles may not be as big of a problem for you. Ann Anderson is here from Bremo Pharmacy, and I think most people believe that if you had chickenpox as a child, that it can never come back and you'll not get shingles.
It's chickenpox as a child that does cause shingles as an adult. So if you've had chickenpox, and millions of Americans have, you are at risk for getting shingles.
Now, why is that? I mean, you have the chickenpox vaccine, you develop the antibodies to it, so how does the virus just stays in your system?
The virus does stay in your system, yes. Once you've had chickenpox, the rash clears, but the virus never goes away. It lays dormant in your system, and at some point during your life, usually with advancing age, past 50, or immunosuppressive drugs, or stress, or illness, can cause that virus to reactivate, or it may reactivate for no reason. Reactivate, and then you get a painful, burning, tingling rash on one side of your body, little red blisters, and then it ends up in huge, painful clusters of blisters.
And that's the shingles.
And that's shingles, or herpes zoster, or some people just call it zoster.
Okay, so when you get shingles, is this a long, I remember chickenpox being, maybe a week. Is shingles, are there long-lasting effects from shingles?
Shingles, the outbreak itself is comparable 7 to 10 days, but it's the pain afterwards, the post-herpetic neuralgia, that is what can be really debilitating in people. And what you hope to avoid is that pain after the rash is gone.
Okay, is that pain in your nerves? Is it pain? How does the pain present itself?
Just burning, hurting. It's different for different people, but it can last for months to years and be very debilitating in people.
Now, once you get shingles, if you get shingles, does that have a chance to have reoccurrences as far as the rash and everything continuing to come back?
You can get shingles again, yes. Everybody's got about a 30% chance of getting shingles, and a second case, you've got about a 30% chance of getting it as well.
All right, so the Zostavax vaccine can prevent shingles?
It won't totally prevent shingles, but it will certainly lessen your chance of getting shingles, and also if you do get shingles, it should be a milder case and lessen the post-herpetic neuralgia, or the pain that remains once the rash is cleared.
All right, now who should get this vaccine then?
The CDC recommends those who are over 60. The drug is approved for those who are over 50. And regardless of your shingles history, whether you've had shingles or not, those people should be vaccinated.
Okay, so only people, at least the minimum age then is 50.
And 50 because before 50, the incidence of getting shingles is not that high, but after 50, your risk triples.
All right.
And the chance of getting pain is much higher after 50.
We don't want either one of these things, so we want you to call Bremo Pharmacy and find out about the Zostavax vaccine. If you're over 50 and you've had chickenpox, this is a real problem for you. Also, ask about the free osteoporosis screening. Get all the details at BremoRx.com.